Hello again, it's Mr. Sater, instructor at Dublin-Scioto High School. Today I'm going to be going over problems of the spine. Two main problems we're going to talk about are herniated disc and curves in your spine. Let's start with herniated disc. A herniated disc happens when your disc between the vertebral bodies either dry out as you age. They can happen to people who have hyperextended their back. So if you've over twisted your back, you can push on that disc so hard that it weakens. The disc is a little bit like a jelly donut. So here's a picture of it, and you can kind of see that pink ring on the outside, which is called the disc annulus. And then there's jelly on the inside that we're going to call the nucleus pulpopus, and this gives you a lot of cushioning. It kind of acts as a shock absorber. In the morning, when you haven't been pushing on these all day, when you're lying in bed, supposedly you're a little bit taller than right after the end of your day. Your disc have compressed so much that you lose about an inch or so of height throughout the day. So these carry a huge amount of weight. The tissue they're made out of is some of the toughest connective tissues in our body. But when we overdo it, you can see here on the picture on the right-hand side, we can break that disc annulus, and the contents of it will push out onto some of the most important nerves in our body. And when that happens, that nerve gets pinched, and it can result in all sorts of problems. The number one problem you're going to have is just pain and tingling in the affected nerve. And so while this injury might be happening, say in your lower back, you'll feel the effects of it in whatever nerve innervates, whatever part of your body is innervated by that nerve or controlled by that nerve. So you may have an injury in your back and your leg be perfectly normal, but when that is pushing on there, it can cause pain to shoot down your legs or other parts of your body. Here's some further pictures of it. You can kind of see on the left we've got a normal one where everything's labeled here, so you might want to take a look at that. You've got a bulging disc in the middle. That one hasn't broken all the way through, but you can see that disc annulus pushing out on that nerve. And then on the right, we've got the herniated disc. Herniated just means sort of torn open, and you can see it pushing on that nerve again. Here it is on MRI. You can see at the top there on the left-hand side a normal disc, and then moving down you see a bulging disc kind of pushing on the spinal cord, and then the herniated disc. The picture on the right side with the yellow arrows, you can see the disc has leaked out quite a bit. And the green arrow looks to me to be another bulging disc. So herniated disc, just kind of know that those discs are between the spinal bodies. Just to review the disc anatomy, look at the left side there. That's the disc annulus and nucleus pulpopus in the middle there. Jelly donut. All right, this time we're going to talk about abnormal curvatures of the spine. The most well-known one is probably scoliosis. High school kids usually will get checked for scoliosis by school nurses and during their normal medical checkups because it happens during puberty. We have abnormal curvatures of the spine. We're not sure what causes it. We don't really know much about it. There are some diseases where it shows up quite a bit with like cerebral palsy, but we're not sure what causes just a typical scoliosis. Here's an x-ray of a pretty severe case. You can kind of see on the left side there that first thing I want you to notice is look up at the person's shoulders and they have a tilt to them. And that's one of the number one signs that scoliosis is happening. If you just look at this person with normal clothing on, you may not be able to tell that they have scoliosis. But when you look at those tilted shoulders there, that's a dead giveaway. This is a pretty severe case of scoliosis in both the lumbar and the thoracic region. Take a look at the ribs, how they're spreading open on the right side, and then on the left side they're kind of crowded a little bit. And then after treatment, you can kind of see the x-ray there shows that she had rods put in her spine to straighten it out.
Her shoulders look to be fairly even, and we can see that her ribs have a normal distribution. Here's an example of a before and after case where you can actually see the person as they are showing up in a physical exam. On the left there, you can kind of see the shoulder blades aren't matching up, and she has a pretty severe case as well. And she was treated with rods too. You can see the post-operative scar there going down her back. Quite a big incision there. All right, here's another case. This person, you can kind of see the sway pretty easily, and you can see how well it's been corrected. When the school nurse checks you out, she's looking for something like this. She'll ask you to sort of bend over and do a reach for your toes, and you can see quite easily the shoulders are not sort of lined up with the floor. You can see that curve there in the lumbar region. So scoliosis. What are some treatments of scoliosis? Well, we already talked scoliosis. We talked about the spinal rods. Okay, it was a big time surgery. But these are severe cases. A lot of times, if it's not a severe case, we can give you a brace that you have to wear that'll either stop the progression of scoliosis, and usually you don't have to wear that into adulthood. So not always going to be something as severe as spinal rods. There's some physical therapy and other things we can do to manage you and get you some range of motion back, but those are the main two treatments. All right, this next one is called lordosis, and this is an exaggerated lumbar curve. So you can see on the right there, you've got a picture of a normal lumbar spine, which does have a little bit of a curve to it right above your butt there. You can kind of see that normal curve on the right side, but when it's really exaggerated, we call that lordosis. Some people call this sway back. There's another name for it where horses that were too much weight was put on horses, like maybe saddleback or something like that. I cannot remember the exact term, but anyway, lordosis. We're not exactly sure what causes it. In animal biology, lordosis is actually something animals do as a sign that they might be ready to mate. So female animals will do this. So sometimes used in biology as during reproduction as something that maybe a field researcher looks for if they're studying that sort of thing in animals. This also happens as pregnancy progresses. Your center of gravity kind of changes, so you can see a temporary lordosis during pregnancy. If you look at the gal on the right there, she's got a pretty big curvature in her back. Just if she's going to maintain her balance, she has to have that curvature in the back just to change her center of gravity over her feet. So a lot of women will get lower back pain with pregnancy, especially shorter women who have to really exaggerate this to keep their center of gravity. So lordosis happens in the lumbar region. Just a way to remember that, lordosis starts with L, lumbar starts with L, so that's where that change is going to happen. A way to remember scoliosis, if you have to, is that curve kind of looks like a letter S sometimes. Remember, scoliosis is a lateral curve, and lordosis is in the opposite plane. All right, kyphosis happens usually in elderly women who are going through osteoporosis. A lot of times the bones in the spine will lose some of their cohesion and start breaking down and compressing due to osteoporosis. And so you'll see sometimes this mild hunchback is what it's commonly called in older women who suffer from osteoporosis. It can be very severe where the person is bent almost completely over, or it can be pretty mild. That's usually where we see kyphosis. So kyphosis happening up in the mainly thoracic and cervical areas. So these are the abnormalities of the back that I'd like you to know about. This information is on the test. I'll basically give you 3 pictures of abnormal spines. You can find those on page 154 in the books. There will be something very similar to that, and I will ask you to identify which abnormality it is, and I may ask you who it shows up in. So if I would ask you, well, this problem is common in pregnant women, you would say lordosis. If I said, well, this problem is common in elderly women who suffer from osteoporosis, you would tell me, well, that's going to be kyphosis.
All right, hopefully this video gets you fully ready for our test over the spine.